Hello. In this presentation, we'll be going over the certification application process. This presentation should assist you when you are ready to submit and complete an application to be reviewed and approved so that you can provide services for recipients of home and community-based waiver or personal care services. Through the certification process, our role is to certify qualified health service professionals to ensure the delivery of quality services to recipients of home and community-based services. For more information about the certification process, please visit the rules and regulations that are listed here below. SDS has established standards to ensure that services are delivered by individuals with the requisite skills and competencies to meet the needs of the waiver population and ensure that services are performed in a safe and effective manner. SDS standards are specified in the Home and Community-Based Waiver Regulations, the Conditions of Participation, and the Service Conditions of Participation. Services are available for individuals who are enrolled in one of our waiver programs. It is important for the provider to know and understand the waiver types that they will be servicing. Senior and Disability Services Training Unit can assist with initial required trainings, continuing education hours, and ongoing support. If you need to gain more understanding of Medicaid health programs, you can click on the large icon on the right to be fast-tracked directly to the resource slide within this presentation. But don't forget to come back to this presentation when you're ready to begin the certification process. Home and community-based services encompasses two program types, home and community-based waiver and personal care services. Each program type has its own procedures and regulations and each have a separate application. The organization chart identifies home and community-based services, the two program types, waiver and personal care services, waiver services, and waiver service subtypes. The application guidance is the best resource to ensure your submission is complete. We encourage providers to review the guidance and provide the required documents when submitting an application. You can directly click on the icon here or the direct link to review the application guidance. There are two application types. The initial application is for first-time providers, and a renewal application will be for providers that are recertifying a current certification. Both applications are similar, but there are some differences. Both applications will need to include SDS-approved forms and the core requirements. An initial application is required to submit a business operations manual to include policies and procedures about how the business will operate. An operations manual is not applicable to a business that only provides transportation or environmental modifications. Renewal applications require the Quality Improvement Report. Renewing providers are operating in accordance to their own policy and procedure to collect data through the certification period to compile into a Quality Improvement Report. Renewal applications do not require the operations manual to be resubmitted unless the provider has changed business practices, which then would require an update to the specific policy and procedure, or if there was a change in the state regulations that would require providers to update their policies and procedures. Here is an application checklist of the minimum requirements that is needed to submit a complete application. The checklist includes the application, which would include a Cert 01, Cert 02, or Cert 36, the matching service declarations if applying for waiver services, a business license, the certificate of insurance for general liability, and certificate of insurance for workers' compensation or the workers' assurance form, which is a Cert 03. Please review the application guidance for additional information regarding the required certificate of insurance. In a complete organization chart for the business, and initial applications will need a complete operations manual, and renewal applications will require the Quality Improvement Report. An application can be determined incomplete. To ensure the submission is complete, here are some things to review. The provider must sign and date all SDS-approved forms. Application must have the minimum required documents. And do the services selected on the application include a matching service declaration? Are the provider's services consistent with the current certification services? Remember to report business changes like ending services. The reports can be submitted using a Cert 42 or Cert 44. Incomplete applications are not considered a valid submission. If the application is missing one of the minimum requirements that we discussed in previous slide, it is likely you will receive an incomplete notification via email. Providers will need to self-review the documents that they submitted to the PCC unit in order to determine what is missing or incomplete. The entire application needs to be resubmitted to include all documents, including the missing pieces, that would make the application then complete and eligible for review. Review application guidance for additional information. When you're ready to submit your application, you can do this in several ways. Email is the preferred method, and our email address is dsdscertification@alaska.gov. You may also fax it to 907-754-3452 or our in-office location, which is 1835 Burgosh Street, Suite 350, Anchorage, Alaska 99508. If you are dropping off your application in person, please do not include things like staples, paper clips, dividers, sheet protectors, only paper documents. And please only send documents that are required for your certification. And please do not submit protected health information. Here are some additional resources that can assist you with questions or gaining more comprehensive information about home and community-based services, certification and compliance, and other programs that senior and disability services are involved in. Thank you for your interest in the certification process. As a reminder,